This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 renal questions. Just a reminder that you can find all of these questions and many more at medprep2go.com. If you'd like to get involved with this project, please contact me at ted.medprep2go@gmail.com. And if you like what we're doing, please let your friends know about the project and consider giving us a review. All right, let's start with the first question. A 27-year-old man is brought to the emergency department by his wife after she found him collapsed in their garage. His wife says he was recently fired from his job as an insurance claims adjuster and has been struggling to find work for the past month. He has no history of serious illness or hospitalizations. He does not take any medications. His temperature is 98.6 degrees Fahrenheit, which is 37.0 degrees Celsius. Pulse is 90 beats per minute, respirations are 9 per minute, and blood pressure is 130/80 millimeters of mercury. Physical examination shows a stuporous man with depressed respirations and needle track marks on his left arm. Laboratory studies show hemoglobin 14.8 grams per deciliter, leukocyte count 8,000 per cubic millimeter, platelet count 315,000 per cubic millimeter, serum sodium 138 milliequivalents per liter, serum potassium 5.5 milliequivalents per liter, chloride 100 milliequivalents per liter, creatinine 2.2 milligrams per deciliter, and BUN 25 milligrams per deciliter. Urinalysis shows a pH of 6.5, negative nitrites, negative leukocyte esterase, negative glucose, negative ketones, 1+ protein, 3+ blood, 0 red blood cells per high-powered field, 0 white blood cells per high-powered field, and no epithelial cells. Which of the following is the most likely cause of the patient's abnormal laboratory values? A, acute gastrointestinal bleeding, B, breakdown of muscle tissue, C, decreased fluid intake, D, hemorrhagic stroke, or E, urinary tract infection. The correct answer is B, breakdown of muscle tissue. This patient presents with altered mental status, respiratory depression, and track marks on his arm, increasing suspicion of intravenous drug use. Drugs like opioids can cause significant central nervous system depression, which may lead to prolonged immobilization after falling unconscious. Rhabdomyolysis is an important consequence of drug intoxication and prolonged tissue compression. The breakdown of muscle tissue can cause the laboratory derangements seen in this patient, which include hyperkalemia and increased creatinine and BUN, which are all due to cell lysis and subsequent acute kidney injury. The blood noted on urine dipstick testing is due to myoglobinuria rather than the presence of red blood cells in the urine, which is why urine microscopy does not demonstrate the presence of red blood cells in this patient. Answer choice A, acute gastrointestinal bleeding, is incorrect. GI bleeding may cause altered mentation and tachycardia, especially if there's an active, significant bleed, and may thus cause ischemia-associated acute kidney injury. However, the patient does not have any risk factors for GI bleeding, and his hemoglobin is normal. Moreover, his clinical history and physical examination point more toward drug use and prolonged immobilization. Answer choice C, decreased fluid intake, is incorrect. Loss of consciousness for long durations can lead to decreased fluid intake and thus cause ischemia-associated acute kidney injury. However, hypovolemia will not explain the presence of blood on urine dipstick. Answer choice D, hemorrhagic stroke, is incorrect. Although hemorrhagic stroke may present acutely and cause altered mentation, it does not adequately explain the patient's hyperkalemia, acute kidney injury, and blood in the urine. Answer choice E, urinary tract infection, is incorrect. Urinary tract infection may show positive blood on the urinalysis. However, the patient's clinical picture and the lack of evidence of bacteriuria make it less likely. The key learning point here: rhabdomyolysis can result from prolonged immobilization and compression of muscle tissue. Laboratory findings will show hyperkalemia, increased BUN and creatinine, and positive blood on urine dipstick with 0 to few red blood cells on urine microscopy. Question 2. A 68-year-old man is brought to the emergency department with complaints of dizziness and decreased urine output over the past 2 days. He has a history of hypertension and type 2 diabetes mellitus. He takes lisinopril, hydrochlorothiazide, metformin, and glipizide. His blood pressure is 90/60 millimeters of mercury, and his heart rate is 110 beats per minute. On physical examination, he appears dehydrated with dry mucous membranes and poor skin turgor. Laboratory results show a blood urea nitrogen, BUN, level of 60 milligrams per deciliter and a serum creatinine level of 2.5 milligrams per deciliter. Urinalysis is bland. Calculation of the fractional excretion of sodium, or FeNA, is 0.5%. Which of the following is the most likely diagnosis? A. Acute interstitial nephritis. B. Acute tubular necrosis. C. Glomerulonephritis. D. Postrenal acute kidney injury. Or E. Prerenal acute kidney injury. The correct answer is E. Prerenal acute kidney injury. The most common cause of prerenal acute kidney injury is hypovolemia. This patient's presentation of dehydration, elevated BUN to creatinine ratio greater than 20, in this case, it's 60 divided by 2.5, which is 24, and a fractional excretion of sodium, or FeNA, of less than 1%, are indicative of prerenal acute kidney injury as the kidneys try to retain sodium. Answer choice A, acute interstitial nephritis, is incorrect. Acute interstitial nephritis typically presents with fever, rash, and eosinophilia, often in response to medications, and does not usually show a high BUN to creatinine ratio or a low FeNA. Answer choice B, acute tubular necrosis, is incorrect. Acute tubular necrosis often presents with a FeNA greater than 2% and a BUN to creatinine ratio closer to 10 to 15, typically following ischemic or nephrotoxic injury. Answer choice C, glomerulonephritis, is incorrect. Glomerulonephritis often presents with hematuria, proteinuria, and red blood cell casts in the urine, which are not seen in this patient. Answer choice D, postrenal acute kidney injury, is incorrect. Postrenal acute kidney injury is usually caused by obstruction of the urinary tract and often presents with symptoms of urinary retention or hydronephrosis, which are not present in this case. The key learning point here: the most common cause of prerenal acute kidney injury is hypovolemia. Look for a BUN to creatinine ratio greater than 20 and a fractional excretion of sodium less than 1% as the kidneys try to retain sodium. Question 3. A 72-year-old man is admitted to the hospital with severe sepsis secondary to a urinary tract infection. Past medical history includes hypertension, hyperlipidemia, benign prostatic hyperplasia, and squamous cell cancer of the skin. Despite aggressive fluid resuscitation, his urine output remains low. Laboratory results show a blood urea nitrogen, BUN, level of 40 milligrams per deciliter and a serum creatinine level of 3.0 milligrams per deciliter. Urinalysis reveals muddy brown granular casts and free renal tubular epithelial cells. The fractional excretion of sodium, FeNA, is 3%. Which of the following is the most likely diagnosis? A, acute interstitial nephritis. B, acute tubular necrosis. C, glomerulonephritis. D, postrenal acute kidney injury. Or E, prerenal acute kidney injury. The correct answer is B, acute tubular necrosis. This patient has sepsis with persistence of acute kidney injury, or AKI, despite aggressive fluid resuscitation. Acute tubular necrosis, or ATN, is the most common cause of intrarenal acute kidney injury. The three major causes of ATN are kidney ischemia, sepsis, and nephrotoxins. The classic urinalysis of ATN reveals muddy, brown, granular casts and free renal tubular epithelial cells. The fractional excretion of sodium, FeNA, typically is greater than 2% in ATN. Fluid repletion will typically correct pre-renal disease, while the AKI will persist in ATN. Answer choice A, acute interstitial nephritis, is incorrect. Acute interstitial nephritis typically presents with fever, rash, and eosinophilia, often in response to medications, and does not show muddy, brown, granular casts or a high FeNA. Answer choice C, glomerulonephritis, is incorrect. Glomerulonephritis often presents with hematuria, proteinuria, and red blood cell casts in the urine, which are not seen in this patient. Answer choice D, post-renal acute kidney injury, is incorrect. Post-renal acute kidney injury is usually caused by obstruction of the urinary tract and often presents with symptoms of urinary retention or hydronephrosis, which are not present in this case. Answer choice E, pre-renal acute kidney injury, is incorrect. Pre-renal acute kidney injury typically presents with a BUN to creatinine ratio greater than 20 and a FeNA less than 1%. Urinalysis typically is normal or near normal, with hyaline or fine granular casts that are sometimes seen. Fluid repletion usually corrects pre-renal AKI, which is not the case here. The key learning point: acute tubular necrosis is the most common cause of intrarenal acute kidney injury. The three major causes of ATN are kidney ischemia, sepsis, and nephrotoxins. The classic urinalysis of ATN reveals muddy, brown, granular epithelial casts and free renal tubular epithelial cells. The fractional excretion of sodium, FeNA, typically is greater than 2% in ATN. Fluid repletion will typically correct pre-renal disease, while the AKI will persist in ATN. That's the end of this episode, but please check out our other episodes as well as all of our content at medprep2go.com.
The new year brings new health goals and wealth goals. Protecting your identity is an important step. Your info is in endless places that could expose you to identity theft, leading to lost funds. LifeLock monitors millions of data points per second. If your identity is stolen, our restoration specialists will fix it, guaranteed, or your money back. Resolve to make identity health and wealth part of your New Year's goals with LifeLock. Save up to 40% your first year. Visit lifelock.com/podcast. Terms apply.